Hi, my name is Lina and my student ID is 08211323.
And I'm Jeyaseelans, ID number 0953374.
The following is our verbal presentation for the Psychology and Lifespan Development paper, which is based on John Heron's book, Helping the Client.
What is cathartic intervention? Cathartic intervention is a type of intervention that helps the client to work through painful or unresolved distress that is disabling or distorting of their behavior.
Depending on the level of stress and the stage of stress the client is in, the health practitioner can determine when and how to intervene.
There are two basic levels of client distress. Those near the surface include yawning, which is a sign of fatigue, and laughing, a sign of embarrassment.
The other level of distress is deeper. These are signs like grief through sobbing, release of anger through violent behavior, release of fear through trembling and shaking. If excessive distress emotion is repressed and denied, it will build up like a time bomb, explode without any warning, and cause compulsive, distorted behavior.
As we will both be entering into the nursing environment, we will focus on the deeper levels of client distress, as this is the kind of distress we will most likely encounter in our profession. Nurses could apply this intervention to help the patients to come in contact with their distressing emotions.
Cathartic intervention is important to the nursing discipline because we'll be in contact with many patients, their families and friends who are in some form of distress. If a nurse cannot recognize or does not know how to deal with these symptoms, it can be detrimental to the patient's well-being.
The let-out of these emotions and feelings enable the client to keep some attention free of the distress while self-recovering from it. It is important that a nurse can detect when a patient is in a negative emotional state and bring them back up into a positive emotional state.
In order for catharsis to occur, the client has to be willing to do it. They have the right to review the intervention. This is called the cathartic contract.
An in-depth contract is long-term and involves ongoing counseling or group therapy by a professional who has appropriate training and preparation in this field.
As nurses, we'll be working with short-term cathartic intervention because we're able to help the clients with their initial emotional state during or after a distressing situation.
For catharsis to work, the nurse must be permission-giving, accepting, and supportive of the client and their emotional states.
To apply the cathartic intervention to our discipline, we are performing a short role play with me being the patient, who has just found out that she's diagnosed with terminal illness. She's in the state of shock and denial of the diagnosis.
Hello there, how are you feeling today?
Crap.
You feeling crap?
Feeling crap. Everything's just crap.
Do you want to talk to me about it? I am here for you if you want to talk or let anything out. It's okay to feel it. What's going on? How are you feeling? You're obviously sad about it.
I just found out I got cancer. And I'm dying. I'm feeling worse and worse every day.
Oh, come here. This is such a rough time.
Oh.
Do you have any family or friends that can help you through this?
No.
No?
No, I don't have any friends. I don't have any family.
That's okay. What we'll do is we'll get the doctor and we'll help you get into a support group. They're going to be here with you every step of the way. It must be so overwhelming right now, but it's okay to feel this way. Such a huge shock.
It is a huge shock to me. I don't want to die. Not yet.
It's okay, you can let it out.
Thank you.
It's alright. Anytime you want to do that, okay?
Thank you.
From the above example, we can see that the nurse helped the patient to release the distress by acknowledging it and encourage the patient by giving permission to express these feelings.
Cathartic interventions are crucial to any healthcare professions. It is likely that throughout our nursing career we will have to perform the intervention at some point, no matter what stage of the distress the patient is in. Thank you for watching our presentation.